Hi, I'm Matt. I'm a clinical psychologist and I'm here to talk to you about emotional well-being. It's really common for people to feel a whole range of emotions from the point of diagnosis through their treatment and after treatment. I think it can often be a surprise to people when treatment finishes that they experience lots of emotional ups and downs. This has potentially been a very traumatic experience, and there may have been many changes to your life as a result of cancer and its treatment. You may have noticed that your body has changed through the treatment that you've been through, or you may have had to take an extended period of time out of work for a number of months or even years. Family life might have been up in the air, and your routine might have been knocked out. So you may also find that you feel lonely or isolated because other people in your network may not necessarily understand how you're feeling. Whilst people are on treatment, it's very common for people to get a high level of support from services, from nurses and doctors and friends and family. And at the end of treatment, some of that support can sort of feel like it's melted away, and people describe often experiencing a bit of a cliff edge in terms of the level of support that they have around them. I would advise people to reach out, speak to your friends, your family, or to your colleagues to help them understand what you're going through. There's many patient support groups that people can access, and you might find those through charities, face-to-face, and also more and more online or through social media. Talking to other people who've been through something similar can help to make that experience feel less isolating. And also it can be helpful to find out how other people are coping and any tips or ideas that have helped them. A support group specifically for younger people, such as TrekStock or Shine Cancer Support, or there's more well-known charities such as Breast Cancer Care, Prostate Cancer UK, and so on. There's a temptation for many people to try to resume the life that they were leading before the cancer experience. And what I would suggest is that maybe this is an opportunity just to take stock and to think about what your priorities are, think about what's important to you, and think about actually how you want to develop that new reality or new normal for yourself. If you notice that you're feeling stuck with feelings around anxiety or low mood, depression or stress in the way that perhaps it may be getting in the way of you living your life or getting back into living your life, I would suggest speaking to a GP or speaking to someone through a charity or to the hospital that you've been treated through, where you may be able to be directed towards more specialist support. And that may be seeing a psychologist or a counsellor, or it may be having a discussion with maybe someone like a support and information service specialist. One of the most important things to do is just to be kind to yourself and to look after yourself. Take time to get back into a routine and not to rush things. And if you notice that your stress level does sort of increase, or you notice that you do feel a bit wobbly at times, then it may be helpful to take a bit of time out, think about what helps you to relax, and then maybe going for a walk or speaking to a friend or reading the newspaper. Some really simple things that actually can have a really profound effect on helping to just slow you down and to look after yourself in what is likely to be a really stressful period of your life.